Well, the recent announcements of big economic development projects here in North Carolina mean we will be importing thousands of more people to fill those jobs.
With North Carolina finally joining most other states in expanding Medicaid, there is still the question of who will treat all these people. This evening in the Buckley Report, Bob looks at if our healthcare system is keeping up with that growth.
When North Carolina and South Dakota fully implement their expansions of Medicaid, they will be the 39th and 40th states to do so. In North Carolina's version, people making up to 138% of the poverty level are eligible for health care coverage, which in this state is about $41,000 for a family of four.
How big a deal is this?
Medicaid expansion is huge for North Carolina. We hear all the time about the rising costs of health care. And the best way to lower the cost of health care is for everyone to have a primary care physician.
But there aren't another 10 or 20,000 of them out there.
Absolutely. That's a huge challenge.
Absolutely.
One not lost on State Senate President Phil Berger.
Is this state ready for 500,000 new people who can access the healthcare system?
I don't think we're ready now. The reality is we are not training enough doctors and nurses and other health personnel at the present time to meet the demand that is out there.
And if we look at the age of our nurses today and we look at what the likely path for retirement, we're going to continue to lose some nurses, just quote, aging out, right?
Mm-hmm. But it's a great job. Are we not getting enough young people to do it?
We are not.
Some in the General Assembly believe the way to fix that is legislation called the SAVE Act that's now in both the House and Senate. It's designed to allow healthcare professionals other than doctors to, in the words of the legislation, practice to the peak level of their training and licensure. So certified nurse practitioners, certified midwives, clinical nurse specialists, certified nurse anesthesiologists, and physician's assistants can take on much of the increased workload. But
we're meeting some resistance from other healthcare personnel that are, in some respects, protecting their exclusive right to do certain things.
I believe in a model where we work with nurse practitioners and physicians to provide primary care coverage.
So do you support the SAVE Act then?
I think I would support a version of the SAVE Act. I think the first year or two out of school, a nurse practitioner does need oversight by a physician, but once they have experience, then I could support that.
In addition to that, I mean, we're expanding the capacity of our medical schools to train doctors. We're funding additional slots and making sure that our nursing schools have the resources to train nurses.
even with the SAVE Act and graduating more healthcare providers from our schools, it will take time.
How many years do you think it will take to develop the number of providers we need to handle this load of new patients?
If we went all out using all of those modalities, perhaps 3 to 5 years, we could see it.
But without the SAVE Act, that timeline could extend for years. Bob Buckley, Fox 8 News.
Governor Roy Cooper supported the version of the SAVE Act the Senate passed last year. If they can get it through the House, the governor is likely to sign it.